Nicola, when you got diagnosed with breast cancer 3.5 years ago,
I did.
Could you just explain and capture your experience, what had happened up to that point previously before you had breast cancer?
Okay, so I had two quite young children, wasn't sleeping, was constantly ill, picking up every bug, not recovering very quickly.
So your immune system felt quite...
My immune system was really poor, but I didn't really understand what that meant. It didn't occur to me. I was 39, nearly 40.
Okay.
Cancer wasn't on my radar. I just thought I was tired.
Sure.
But
especially with two young children.
Yeah, and they didn't sleep, so
yeah.
which is really key actually, part of breast cancer.
That's fine.
So yeah, so this is what happened. So I contracted swine flu, and I got very, very ill with that, and I was bedridden for a few weeks, which is really big time when you've got small children. So I lost a lot of weight, and at that point I felt a lump in my breast.
Okay.
So my doctor came out, did a house call, straight to the breast clinic. It was clearly quite big, quite serious. I went straight through this one-stop breast shop, or some horrible thing they call it. So from a physical examination to a mammogram, and then straight into 7 biopsies. At this point I was in a wheelchair, so I was quite ill.
Goodness me.
And so I think the doctors were very concerned that it spread, so they just threw everything at me. But obviously this process takes a while between biopsy and diagnosis. I think it's a week.
What's 7 days? Okay.
So it's 7 days for everything. So between, and then there was a CT scan, which was a further week, showing no obvious spread, and then another week for a PET scan. It kind of went on like that for maybe a month. From diagnosis to mastectomy was maybe a month.
Notwithstanding the fact you were obviously ill, which perhaps reduced your energy levels to cope with this anyway. But what's it like emotionally dealing with that news at the time?
Do you know what's funny? I really thought, this is it. I've known something's wrong, and this is what it is, and now I can start working.
Okay, so ironically, it kind of brought that to a head for you.
It was scary. Yeah, obviously, I thought, am I going to die? Am I going to leave my children? It was very scary. And I felt really strong resistance to doing chemotherapy because I was already so ill. I really thought chemotherapy would kill me at that point. I'd lost a lot of weight, had no immune system. It just didn't make any sense to me, and I never felt like I was being looked at as an individual, as a very weak and quite young woman really to have breast cancer. I felt like they were trying to tick boxes and fulfil quotas, and I questioned that a lot. They didn't like me much.
I suppose that in this internet age, it does give you that advantage, doesn't it, to do your own research.
Massively.
And get that extra information.
And there's a lot of people doing it this way. You can do it really quickly, actually. You can find resources very, very quickly.
So you were diagnosed with breast cancer, then you had the mastectomy, and then what was next proposed for the next?
Next was, so at the point that they took off the plaster from the mastectomy, they told me that there had been some lymph involvement. So they would be going back in through my lovely newly healed scar, which was really devastating actually. That was much, much worse than the breast cancer diagnosis. Because I grew up with this idea that if you had lymph involvement you were going to die, which is really very negative, isn't it? And it's not the case actually. So so they just said, well, we'll do chemo, we'll just mop up any spare cells, which seemed a bit blasé. And I asked what success rate did we have of that, and they said maybe 5%. Which was mind-boggling to me, because I've lost friends who have had chemo and breast cancer who didn't ask that question, I don't think.
So the success rate that was suggested to you was 5%, and that was suggested as the best way to move forward for you because of your acute stage. Okay. So you decided not to go down that route?
Yeah, I started asking questions, and I had a lot of arguments with my oncologist, who was quite a bully. He seemed to think I didn't want to do chemo because I liked my hair too much. It was quite funny. And then I found this woman, Patricia Peach. You know how sometimes people come at you from angles? She was everywhere suddenly. Lots of people recommended her. She was in a lot of things I was reading. And she's an ex-oncology nurse, and she basically, she's not very radical. She's quite centred. She'll give you options from either way. But she reinforced everything I was believing about chemotherapy, about tamoxifen, radiotherapy. She said there were much better ways of going about it. And she recommended a few alternative and complementary doctors to me, and Dr. Eccles was one of those. Okay.
What were some of the side effects of tamoxifen that she suggested to you?
Well, tamoxifen I think can cause endometriocal cancer.
Which for the uninitiated means what?
Lining of the womb.
Okay.
When I asked my oncologist about it, he said, oh, we'll just remove your womb, it'll be fine. So I kind of thought, I'm on this conveyor belt of removing body parts. You've taken my breast, it's not enough, you know, where is it going to end? I think there must be a way of reversing this. And I think also tamoxifen, about 50% of women give up before the 5 years is up because it's really horrible. The side effects are really hard. So hot flashes, menopausal symptoms, it's quite unpleasant. So I didn't really see the point. I mean, I got my prescription for that and it's still hanging up at home. I never took that.
And so, despite your sort of somewhat compromised physical state and what have you, you thought, no, okay, I want to approach this in a different way.
Absolutely.
And then you met Patricia and she advised these different routes.
She did, yeah.
Then Dr. Eccles.
He was part of my monitoring plan. You know, I thought I didn't want to be irresponsible. The idea wasn't to be facetious about it and think I knew better, which a lot of doctors thought I was being a bit of an idiot. It was more that I wanted to monitor carefully and try and reverse cancer through diet, nutrition and other ways. And part of that involves not putting harmful things in your body, not exposing your body to radiation. And Dr. Eccles really fitted with that. And his whole approach actually and his ethos fits with that. So when I met him, I felt like, and I brought my dad with me to my first thermoscan, and my dad was quite sceptical of what I was doing. And I felt that his shoulders dropped after he met Dr. Eccles, because he was a man who was clearly very educated, doing it all day long, who was kind of sympathetic to what I was believing. Yeah. That was really massive for me.
Yeah, and probably very encouraging to have what felt right to you to be validated by another professional.
Absolutely, and particularly with your parents, because you need your parents behind you at a time like that. You really do.
Yeah.
So, and your whole family, yeah.
Yeah, sure. Okay.
Yeah.
And so then, what was the journey? If you can then.
So the journey then. So I did have the second operation, which was a difficult decision to make. But I wanted to know what was happening in my body, which is kind of funny because you don't really know. I had thermoscans, which Dr. Eccles explained to me. Normally you would compare one breast against the other, but when you've had a mastectomy and you have one breast, you compare one scan against another, so you see if changes are happening. I had lots of alternative treatments. I had lymphatic drainage to help with the whole lymph system that was now missing. I had hydrogen peroxide and vitamin C infusions in high doses. I had hypothermia treatments. I changed my diet entirely. I cut out gluten and dairy, alcohol, sugar, salt, went on a very unprocessed organic diet, started juicing, really just changed the whole thing, and did lots of other things at home. So I used a far infrared sauna at home, lots of cleansing.
And it's interesting because I kind of get the impression, not you ever would have wished to have had this to have dealt with in the first place, but I get the sense that as a consequence of dealing with it, you've got in touch with so many great health outcomes.
It's amazing. Do you know what? I think I would never wish cancer on someone. It's very, you do wear it. I do wear it every day. I think I do. But it's changed my life and also my son's lives, definitely. And my husband, the way we eat. In fact, all of my extended family, it's changed everybody.
Yeah.
And to understand there's a way of reversing disease or controlling disease just by what you put in your mouth and the way you live your life is massive, because we're not fed that, are we? We're not taught that.
Sure.
So it's been big. You know, I've quite enjoyed my last 3.5 years.
Yeah.
Maybe not the beginning, was not great.
Yeah.
But yeah.
You have a very positive demeanour, and you seem to be very philosophical about this. If you could possibly wish it, how would you like to see technology and change, having you experienced both the conventional side and the thermographic side? How would you like to see perhaps NHS change or the whole approach to breast health change?
Ideally we would look at women as individuals. We would educate people about nutrition, about environmental factors. I don't think that's going to happen. That isn't how the NHS works, is it? That's not how the system works. It's very much a herd kind of mentality. You treat as many people as you can with one modality. I think people need to take responsibility for their own health. And you know what, I think this is the most important thing that I've learned, that within that system, or within what I'm doing, there's always a choice. You can always make a choice. So you can choose to have, the chemo, you can choose to have the surgery, which I did. You can do any of those things, but you have to be happy with your choice and you have to be informed. And most of us are not informed at the point that we do these things. We're kind of scared. We're rushed into decisions. There's not generally a massive rush. You have got time to do some reading. And there's a lot out there. You can access stuff really quickly, and there are a lot of people doing this.
I suppose one of the difficulties is at the time when you get the diagnosis, you're not necessarily in the best state.
You're just completely consumed by fear. Yeah. Completely consumed with fear that you're going to die. So, yeah, you need some hope. You need to know you have choices, and you need to know you probably actually do have some time.
And I suppose that for any women watching this video that are considering the alternatives, then maybe one of the first things to recommend is do what's right for you. Do some research. It's not to say that one is definitely right or
Absolutely.
definitely wrong.
It's not right for everybody. Absolutely not. I don't think anything's right for everybody. Otherwise, it would be working, wouldn't it?
Sure.
And the other thing is, we all got to cancer in a different way. I can kind of see my path to cancer, that I didn't look after myself. I didn't eat properly. I was run down, stressed, tired, all that stuff. Someone else may have come at it from a completely different place, and so they need to maybe go a different route to get back to health.
Yeah.
It's not about judging. I think it's about empowering yourself.
Yeah. How are things now, day to day?
Good. Really good.
Yeah,
there's a lot of juicing happens. My time's taken up with a lot of juicing.
What's your favourite juice?
Favourite juice? Probably carrots. Bit easy, isn't it? Green juice? It's a bit of a slap in the face in the morning, but it works. Yeah, it's
Brilliant.
good.
Okay. Nicola, thank you for your time. Really appreciate it. Nice to talk to you.
Thank you.
Cheers.
Thank you.